This is Idaho Star's training on administration of medication in childcare. The learning objectives for this training are that providers will recognize different types of medications, identify situations in which giving medication is appropriate, recognize preparation steps for giving medication, differentiate methods for giving medication, and demonstrate documentation of medication administration in childcare. The situations in which giving medication to children in childcare is warranted might include prevention of illness such as diaper cream to prevent diaper rash, or to relieve symptoms such as fever or pain-reducing medication, or to control or cure health problems such as an inhaler for asthma or antibiotics for infections. Children in childcare settings may need medication while attending childcare to maintain health and fully participate in the activities of the day, and to comply with laws, regulations, and best practices. The Americans with Disabilities in Education Act states that programs must make reasonable modifications to their policies to include children with disabilities. Medication should be given at home by the parents if possible. Staff should be trained to properly administer medications if unable to be given at home. First doses of new medications should never be given by childcare staff. Parents, guardians, healthcare professionals, and the childcare provider are all responsible for maintaining children's health. Childcare providers should have a system for reviewing health records, including immunizations, health and developmental screenings, and medical history, and practice daily health checks and proper hygiene practices. Providers should have a system for communicating with parents about sick children and how to get support if needed. Caring for Our Children, the resource for National Health and Safety Standards in Childcare, recommends that all child cares conduct daily health checks which address specific items and that it be documented in the child's file. For more detailed information on recommended practices for conducting daily health checks, refer to Caring for Our Children, which is available online and in print. Hygiene practices which are part of the daily routine, such as hand washing, diaper changing, and sanitation and disinfection, are part of the child care provider's responsibilities for creating a healthy environment. Parents should have an understanding of the inclusion or exclusion policy about sick children. Parents should also understand the facility policy on the administration of medication. For parents to have an understanding of these things, they need to be clearly communicated in writing by the child care program director or owner. Child care health consultants are available to support providers with these or any other health and safety related practices. A prescription is prescribed by a doctor, given by a pharmacist, which is considered controlled. Over-the-counter medication can be purchased without a doctor's prescription, such as vitamins, homeopathic or herbal medications, sunscreen, insect repellent, or non-medicated diaper cream. The most common over-the-counter medications are fever and pain reducers, such as acetaminophen and ibuprofen, cough syrup, and nose drops. Both prescriptions and over-the-counter medications come in generic or brand name, which can be confusing. For example, Tylenol is a brand name of the generic medicine acetaminophen, and Advil is a brand name for ibuprofen. The most common oral medications are tablets, which can be swallowed or chewed, capsules, which can be swallowed or sprinkled, but only with doctor's permission, and liquids. There are 3 different types of liquid medication. Suspension is undissolved medication in liquid that must be shaken. Syrups are sweetened liquid with dissolved medication. Elixirs are sweetened liquid in a diluted alcohol base with dissolved medication. Topical medication can include drops for the ears, eyes, or nose, sprays for the nose or throat, patches, or external creams, which can come in the form of ointment or sprays, usually to treat rashes or other skin problems. Inhalation of medicine is done through breathing or inhaling the drug or medicine by using what is sometimes called a puffer or an inhaler, or using a nebulizer or mist from a machine. The medicine can be in the form of a powder or spray, and it can be administered by nose or throat. Injecting medicine involves the use of needles, either with a syringe or a pen. The medicine is administered under the skin in the muscle or fat. Examples of when this might be necessary in childcare include insulin for a child with type 1 diabetes or an EpiPen for severe allergies. Special training is required in any instance of injecting medication. Childcare health consultants can assist with arranging this training. Let's test our knowledge. Daily health checks are only necessary at arrival and departure. True or false? The answer is false. Daily health checks are an ongoing assessment throughout the day to monitor for changes in health. It is important at arrival and departure, but also throughout the day. What should childcare providers have prepared? Childcare providers need to have a child health assessment and plan, which might include examination results, immunization records, medical conditions, or any required screenings. A child care health plan should be completed by a health professional and provide information about required medications and any diet, environment, or activity-specific modifications. The plan should also include written instructions for giving specific medications and a medication log. Each child must have an emergency contact form, including written permission to contact the healthcare professional working with the child. A prescription label can serve as the healthcare professional's order, as it includes the child's name, name of the medication, form of medication, dosage, how and when to give the medicine, including symptoms, the expiration date, name of the health professional prescribing, and the name of the pharmacy and its phone number. Here is an example of a consent form, which a provider or program may use for documentation. Consent or authorization must be completed prior to any medication being given. One consent form for every medication must be filled out by the parent or guardian. The following medication still requires signed permission from a parent or guardian. However, the center can use one bottle of sunscreen or insect repellent across multiple children unless specified not to by the parent or guardian. If individual bottles are used, they must be labeled with the child's full name and not shared among children. All items must be stored out of reach of children. Child care policies should clearly communicate the specifics of administering medication. They should address who will give the medication, why the medication is being given, what medications can be given, how medication will be given and stored, expectations and responsibilities for consent, and the plan for how records will be kept confidential. When giving medication, always match the label with the consent form. Document that medication was received, including the child's name, name of the medication, and the date it was received. Check the dosing information, that it matches, and that the medication is not expired. Also document the time the parents report as the last time administering a dose to avoid double dosing. As a helpful tip, parents may ask the pharmacy to split the medication into 2 containers to have one for home and one for the child care. Storage areas should be away from the children, but in the same area that they will be administered. The storage area should also be stocked with supplies needed to administer the medication, such as gloves, tissues, or dosing cups. The area should be clean and quiet. In addition, the containers should have child-resistant caps, kept out of reach, be in condition without tears or cuts in the packaging. Childcare providers may also look for storage instructions on the packaging and be aware of product lookalikes. Lookalike medications can have very similar names, look similar, come in containers that are similar. Note that in this photo, the doses are the same, both are antibiotics, both are the same color, and both are given by the same route. The bottles are the same size and color, and the labels even look alike. There is a high potential to make a mistake by giving the wrong medication to the wrong child. Other common look-alike medications include eardrops and eye drops. These come in very similar bottles as well. Always read labels carefully. Medication should be stored in a lockable cabinet. If refrigeration is required, it should be kept separate from food and in a spill-proof container. Exceptions to being locked up include emergency medications, such as an inhaler or EpiPen, or non-prescription items such as diaper cream or sunscreen. To dispose of medication, any expired or unused medication should be returned to the parents or guardians. If medication cannot be returned, check with the local pharmacy or police department for instructions on safe disposal. Let's test our knowledge. The medication administration record does not need to include over-the-counter items used regularly such as sunscreen, lip balm, lotion, or diaper cream. True or false? The answer is true. The medication administration record does not need to include over-the-counter items such as sunscreen, lip balm, lotion, or diaper cream. But written consent with a parent's signature is required in the child's file. Sometimes errors do occur. Common errors can include when the wrong child receives the medication, a child is given the wrong medication, or it's given in the wrong amount or dosage. Or perhaps it's given at the wrong time of day. Maybe the correct medication is given to the correct child, but not as intended, such as putting eye drops in the ear, or vice versa. When errors do occur administering medication, there are several common causes, including not understanding the medication label, not understanding how medication should be given, or poor communication with parents or guardians or healthcare providers. Good communication with families at drop-off and pickup will help reduce medication errors. Always document errors in medication administration and notify parents. This allows corrections to be made in administration policies and further training if needed. Close monitoring of children is required, particularly when children are nonverbal, to determine if there is an unwanted side effect of the medication being given. Common side effects are having an upset stomach, diarrhea or loose stools, dry mouth, drowsiness or being sleepy, and rashes. Sleepiness in one child and hyperactivity in another child can be common with antihistamines such as Benadryl. Side effects can occur at any time from any medication. It is very common with antibiotics. The severity can be mild, as with rashes or itching, to life-threatening, such as difficulty breathing, in which case immediate medical attention is required and you should call 911. Package inserts, a pharmacy, and the prescribing provider are all sources for side effect information. Parents or guardians, the center director or business owner, and prescribing physician all need to be notified when side effects do occur. They should be documented in the child's health file and an incident report completed. Medication incidents are not errors, but still need to be documented. There are multiple situations which would fall under this category, such as if a child refuses to take their medication, spitting out or vomiting a dose, or spilling or dropping a dose. Depending on the nature of the incident, the director, parent, or guardian, and sometimes the prescribing provider should be notified. If a dose is not kept down because it is vomited or spit out, the dose should not be repeated without specific instructions from the prescribing provider, not the parent or guardian. In the event of suspected accidental overdose or ingestion, or any concerns about ingestion or exposure, the Poison Control Center is a valuable resource. It is staffed by registered nurses and medical doctors and can assist in over 150 languages and dialects. You can always call with questions or concerns. There are times when it is not appropriate for the child care to give medications. Some of those reasons can include if the medication is not needed during times the child is in care, if the staff is not trained to administer medications, when the required medication authorization is not on file or is incomplete, or administering the medication is against either facility or licensing policy. There may be instances in which the FDA has not yet approved the medication for use that is not what the medication was intended. Children under 2 years old should never receive cough and cold medications due to possible severe side effects. Adults should use extreme caution in giving cough and cold medicine to children under 6, as they have been shown to be ineffective and still have severe side effects. In these instances, child care providers should work with parents or guardians to have them administer the medications at times when the child is not at child care. Be proactive to ensure that a signed copy of the medication policy is on file, and allow alternative arrangements by the parent or guardians to have the medications administered. Medication should be given in a location where the adult can focus on what they are doing and not be distracted. The medication should be stored within reach of the child care provider in the location where it is being given. The space should be clean, well lit, and free of clutter. It should also be confidential and quiet to protect the child's privacy and be a calm atmosphere. While administering medication in a child care setting, there are 6 rights to be reviewed by the provider: the right child, the right medicine, the right time and date, the right dose, the right route or way to give the medication, and the right documentation. To ensure that the medication is being given to the right child, check the name on the label and the date of birth on the label. Be aware of multiple children with the same name or even twins. Also, have a plan in place in the event there is a substitute teacher who may not know the children. To ensure the right medication is being administered, check the label for the original container and that the expiration date has not been exceeded. This is especially important if a child is taking more than one medication. To ensure the right dose is being given, the adult should check the label on the medication and use only the proper measuring tool, and check the measuring tool very carefully. To ensure that the medication is being given at the right time, The child care provider should check the permission form and the label. Give the medication within 30 minutes before or after the prescribed time. Note the time given using the time and the date. Check the permission form and label on how medications should be given. Write in ink on the child medication record the time and the date the medication was given. Note any written mistakes and double-check documentation. Document any observations such as side effects. With any concerns, contact the parent or healthcare provider. Some medications are prescribed as needed, such as albuterol inhalers for wheezing. Make sure you have additional details on how to administer medications that are provided as needed. Child care health consultants can support providers with training on administering specific medications. Child care providers should always wash their own hands before and after administering medication, and wear gloves when putting medication in a child's mouth or putting on a topical medication such as creams or ointments. This will reduce the spread of germs and prevent medication from being absorbed through the provider's skin. Prepare the child by letting them know you will be giving them their medication. Explain to them the procedure by telling them what you're going to do. Wash the child's hands if needed, and finally position the child before administering the medication. Never call medication candy. Calling medication candy sends a message that medication is something that can be taken any time and encourages children to get into medications on their own, which can lead to severe complications or overdoses. It can also give a false sense of trust to the child, as it implies that medication will taste good like candy, which is often not the case. Many medications don't taste good. Being honest about the medication and why it is needed builds trust about the medications and why they are needed for specific reasons, by saying things like, "This medication is going to make your runny nose feel better. It doesn't taste very good, but you can have a drink of water to wash the yucky taste out of your mouth after you take it." To review, the steps for giving medication are wash hands, check the 6 rights, prepare the medication, check the label again, and give the medication. After giving the medication, check the label again, return the medication to its proper storage, record the time, date, and dosage on the medication log, clean the administration tool, the dosage cup, or whatever tool was used to give the medication, wash hands again, and observe the child for side effects. For infants, positioning a child prior to administering medication will look different depending on the age of the child. With infants, you will need to support their head and hold them semi-upright. Keep their arms away from their face. Gently press on the chin to open their mouth. Rock the baby before and after giving medication. Use a syringe or dropper to give oral medication before feeding, unless otherwise directed. For toddlers, ask parents how they give medication, and give the child a choice. Would they like to sit or stand? And tell the child the procedure. Tell them what you're going to do. With older children, it is appropriate to explain the purpose of the medication and involve them in the process of giving the medicine. Idaho Star's child care health consultants are available to support child care providers. You can contact a CCHC through your Child Care Resource Center by calling the Idaho Care Line at 211. They offer guidance and resources related to health and safety topics, including administration of medication, and communicate with child care providers regarding safety requirements and standards. Child care health consultants can offer on-site coaching on health, safety, and nutrition, and help create policies and procedures to support best practices. Throughout this training, we have mentioned specific subjects that child care health consultants can provide on-site support with. Those include reading medication labels, conducting daily health checks, developing a protocol for appropriate medication administration, and providing training on how to administer specific types of medication.